Hi, I'm Jen and I work in a GP practice in South Bristol, and as a nurse practitioner, and one of my colleagues, a practice nurse there, came up with an idea for a leg ulcer club. She's very passionate about leg ulcer management, so she talked to our practice manager. We're part of a primary care home under the National Association of Primary Care thing, so they got a bit of extra funding from this. And they got together with our local community service provider, Bristol Community Health, BCH, in our neck of the woods, and also with the other practices that worked in our cluster. We're a cluster of 6 GP practices in our part of the world. And we also got together with Bristol Ageing UK, a charity based, has a local branch. And in our local community centre, where Bristol Ageing UK is based, and BCH also have an office there, we have hired a room once a week on a Thursday morning, and we have 20 slots available. Patients they've got a bit of transport from Bristol Ageing UK, provide a little bit of transport. They've got a minibus, and they've got another rental on that morning. So Thursday morning was chosen because that was the morning they were transporting people around for their other event anyway. BCH and some of their patients come down, and any one of the 6 practices involved in the project were coming down, their patients could be referred into it as well. It's a massive open room, it's not a clinical area, so we have buckets of water. We have an HCA who will come and take the bandages off the patient's legs and then soak them in the water, and when the nurses will come around and take the legs out of the water and bandage them, basically, once they've done that. There are volunteers on the desk to say hello to the patients when they come in, and they will sort the paperwork part of it out. And also volunteers bring in cakes and make tea or coffee. Nice. So all the patients who are waiting to have their legs done, there is a little wait. We do about 6 people. We've got 6 chairs basically. So and we normally have 2 nurses on. So at any one point in time, we'll have all patients in all 6 chairs, but only 2 of them will actually be being bandaged at the time. So there's no curtains, there's no screen. So all the patients can chat to each other, and all the ones sitting at the table will have a little gossip and a little piece of cake and their tea or coffee whilst they're waiting. So it's quite a social thing. We have had a minor issue with discharging some patients because they like it and they want to keep coming back. So we've had 1 or 2 of them actually volunteered to come back to help out with the clinic once they were discharged and healed, which has gone very well. Our healing rates are very good. BCH provide 1 nurse. We've got a tissue viability nurse who's there all the time, and we have the other surgeries who are involved provide 1 HCA and or a nurse depending on the rota, and if they don't provide a nurse or an HCA, they have to provide some money in order to get a bank nurse or HCA from the local community service provider bank to keep the staff up. We have in our area, we have our dressings are provided centrally through a thing called Formio. I think that might be unusual to our location, so we don't get them on prescription where we are. We have a central ordering service which is set up by a formulary designated by our tissue viability nurse is in the community, and so we order all that stuff, and it comes every week, and that comes in via a lorry, is delivered, it's stored in the cupboards upstairs and brought downstairs, ready for use basically. So we have all the stock on site. Patients will come in, they get their legs bandages, they're all happy, and then they go away again. That's basically how the system works. Everybody loves it. The downside is the funding is shortly going to run out. We're going to have to rethink how we're going to manage that. But yes, other than that, it's worked really well so far. Do you have any other specific questions about how it works?
What about confidentiality with the patients? How do they feel about exposing their leg ulcers and things like that to other?
We've had no issues with that, basically. I mean, they're all told when they get referred into it that it's a clinic whereby they're going to be sitting in a room with other people, so we advise them to wear loose clothing so no one's got to take their trousers and their tights off. We do have a private room upstairs, so if we had to do a Doppler for somebody, which does involve slightly more clothing arrangement, we take them upstairs to the private room to do that. But we've recently bought one of the shiny new Mezi machines that does a seated Doppler, and not seated, a lying down Doppler in 5 minutes, so that's cut the time out for that loads, which has been really good. That's quite a good thing.
So one of the things we're looking at is depression scores and isolation in these kind of patients. Have you seen any outcome measures for that kind of thing?
It's not something we've particularly looked at, but it would be a fairly easy thing to do, because the volunteers who man the paperwork desk could, whilst they're waiting, having their cake and their cup of tea, you could easily give them a questionnaire to fill in, and then that could go back to probably Bristol Ageing UK, because we have got a small befriending service that they can be referred into if patients want to do that. So that's something we haven't done, but we could probably very easily do if we wanted to.
Okay, fantastic. Thank you very much for your time.
Sorry?
Thanks, Jen.